Who out there is dealing with anxiety? Hi, I'm Dr. Davis. We're here to talk this time about anxiety, how this is actually manifesting inside and how to better deal with anxiety. Most of the times when we have anxiety, sometimes it can come in many forms. Many, may think we pass it down or going through a hard season. Maybe it's even postpartum depression mixed with anxiety. The world we live in is fastly changing. There's a lot of things that could bring on that added stress or angst feeling. How are you when you're anxious, right? You're not at your best. Let's just say that. And what are your solutions? How do you get rid of it? Sure, you could try the latest thing, the greatest thing, exercise, sleep. Yes, all of those are important. But what else can you do to help with anxiety? That's where I want to give you a different resolution, a different view of anxiety. Have you ever had an eyelash fall into your eye and man, the world just stops till you get that out? Now, the reason that's so aggravating and annoying is it falls on your eye. Your eye is nervous tissue, so it's very sensitive. So the same way everything stops till you get that eyelash out, much the same with your nervous system everywhere else. If there is pressure on the nerve, it's going to excite it, heighten it to where it's just at an all-time here. And all it takes is the smallest stressor, the smallest thing to ting. Now you're anxiety ridden. How do we deal with anxiety as a chiropractor and dealing with upper cervical, the region there? Well, if we have pressure right here on the brain stem or stress due to a misalignment, previous injury, a lot of reasons we could be out of alignment there. But that can cause the brain to be in a heightened state, or the smallest stressors can cause it to be angst, or worry, anxiety, fear are more easily set in due to that stress or that pressure. So let's face it, medicinally or medically, what do they do for anxiety? Well, here's a pill for you. Try this out. Truly, if you have to be ridden or reliant on a pill for anxiety, is that truly dealing with the problem? And if you have to take your pill to be normal, to be calm or chill, what happens when the pill wears off? Right, you're still dealt with or dealing with the same problems. So that's where we want to handle this, find the cause, find the root of this, and get the stress off of your nerves. That way you can better balance, better regulate, better function, especially when it comes to hormone control, feelings, thoughts, emotions, all of those. Let's face it, if we're stressed, they're not at their best. If we get that stress off your system, or when we do, you can operate, function, and go through life with less of a heightened state or anxiety-ridden state of mind or lifestyle. This is different. This is new. I know for some of you who've just looking for resolutions or think you have it solved with the medication you're on, I ask you, what happens if the medication runs out? Or I ask you, if it's a child that's dealing with anxiety or nervousness in a classroom or ridden with an angst feeling, what can you do for a child? Do you want to hand your child a medicine to help with anxiety that they have to become reliant on the rest of their lives? That's up to you as a parent. We respect the decisions either way, but offering a resolution to see if there are other options to help. That way we're not dependent on a pill or bad patterns, bad habits, bad ways of living. Is it worth it to you? I would hope the answer would be yes. So we have had major success with this, helping with that, getting people's nervous systems quieted, quieting that storm within to where we're balanced, the gas and the brake work equally and evenly, helping you battle, cope, deal, and move forward with the battle of anxiety. So if you're stuck with this, stressed with this, need help with this, we'd love to help people get balanced lives, get back to living your version of life the way you desire, deserve to. We're here for you, Dr. Davis. We're here to help. Central Georgia Clinic of Chiropractic. We're going to be coming to you with many more topics up in the upcoming weeks. So look forward to this. Once a week, we're going to have a video like this. So subscribe, comment. If you want to have conversations about this, we welcome that. We're here to help you, here to serve you. Take care.